Hello, welcome to the Iyer Clinic video series. I am Dr. Iyer, and today we are trying to do a different format. This is episode number 17. The topic is back pain. Back pain is by far the most common problem that we have, and even though there are some serious versions of back pain, the 99.9% of back pain is actually relatively self-limited. It's fortunate that we don't have every back pain going into a major neurological or orthopedic emergency. Now, if you notice, the spine of our back is not a straight line. It is actually a curve, and it is most exemplified if I trace a line like this. You see, the spine itself is curved, and if I reproduce it outside, it will be like this. This portion is the portion of the neck. This is the chest. This is your mid-back, and this is the region of the spine that corresponds to your buttock. And in each of these, the curvature has a significance. In the region of the chest, it is the ribs that reinforce the curvature of the back. And these ribs hold the thoracic spine relatively stable in its curvature. In the region of its pelvis or the butt, it is the bony pelvis here that holds the sacrum and the terminal part of the spine in its appropriate angle. But in the region of the mid-back, which is where we have our maximum number of back pain, in this region, it is the muscles of your core that operate. And it is important to understand that this now has the architecture of a bow. And this being the core, being the bowstring. And if the bowstring becomes loose, the bow loses strength. This is the most important thing to understand about the back. Notice this architecture is what is seen in most pregnant women. And you all know that almost every pregnant woman during pregnancy complains of back pain because of the stretch of the core muscles by the growing baby inside. The problem is in men, a lot of men gain weight during their wife's pregnancy, but after 9 months the wife loses the weight, the man continues to carry it forward. And so this is one aspect of back pain that needs to be understood, that a healthy core becomes essential for stable back. There is one other aspect of back pain that I want to point out. If I were to draw a line, a horizontal line through the pelvis, this represents the plane when the pelvis is perfectly balanced. Now, in this, you have the muscles of the hamstrings going here, and if these muscles are excessively tight, they exert a downward pull on the pelvis that tilts the pelvis from this stable position like this. And this slight tilt, the tilt is just about a millimeter or so. The tilt is just about a millimeter or so. But this slight tilt produces a traction upon the nerves that come out of the pelvis, mainly the sciatic nerve. And that nerve gets pulled when the pelvis tilts like that. And that is the single most important problem, is tight hamstrings. And any exercise that loosens the hamstrings, and these exercises are stretching exercises for all hamstrings. You can go on YouTube and find it. And stretching exercises for the piriformis. And the piriformis is one muscle that goes in this direction here, right here. And that piriformis muscle is an exquisitely small but important muscle in the stabilizing muscle of the hip. And the interesting thing about the piriformis muscle is that it actually presses the sciatic nerve that comes out in that direction. And in a lot of people, the sciatic nerve either travels beneath the piriformis muscle or through the piriformis muscle, and it literally acts like a scissor. If a tight piriformis squeezes the sciatic nerve like a scissor. So there you have it. The essence of having a healthy back is a tight core, loose hamstrings, and stretched piriformis. If you do these three things, and you can go to YouTube and look up all the exercises that you need to do for planks. You can go to YouTube and look up for all the exercises that you need to relax and stretch your hamstrings, and all the exercises that you need for stretching the piriformis. And there are not many, there are only about 4 or 5 of them totally. If you do that regularly, 5 to 15 minutes a day, every day, I can promise you that you hardly ever have back pain. Now, for those who already have back pain, go meet your doctor, find out if these exercises are safe for you, get his advice, and then move forward in a structured way. This is Dr. Iyer. You're seeing Iyer Clinic video series on education and health topics. Thank you for joining me this morning. We'll see you again next week.